the one that has, so when you read about microcurrent stimulation and its effect on eye disease, all of that data that you read about that's out there is with this machine. There was an early machine. The guy who developed this machine had worked for a company called Electroacuoscope. And that machine is still good, but that machine costs $40,000 now. So that's the kind of machine you'll find in an Olympic training room. He made this smaller machine, which has no bells, no whistles, but it works. It's good enough. So that's enough, and I'm more than willing to talk after this talk if people have questions about technology. Yeah. This one is about 600. So, and if you buy enough of them, you can get obviously some discount. We sell it for more than that because we built into this is all the time that it takes to talk with people. So we basically selling it as a package, yeah. We've worked with this with all kinds of things. This is a great machine for pain control. Yeah. So he's asking about, have we worked with this with pterygium and with other inflammatory conditions of the eye? It's good for a lot of things. But we're mainly using this for retinal disease. Okay, I would not necessarily, I would certainly have somebody try just some simpler remedies first before spending $1,000 on a microcurrent stimulator and a program of treatment. But if they have chronic retinal disease, that looks cheap. And the other thing to realize too is that a standard eye exam, a standard eye exam with fluorescein is about $1,500. So people, the cost of the whole program is less than a single trip to the ophthalmologist. The difference being that your insurance will pay for you to go get $1,500 worth of tests at the ophthalmologist. They won't pay for this. This is just, I just show you just quickly some of the data. This was from Grace's second study. Her first study was 1983 to 1985. She did 114 patients with all manner of diseases, including quite a few with diabetic retinopathy. And overall, it was about 80% or so in that first study. She was criticized for that and couldn't get anybody to publish it because she was testing people herself. So then she did a smaller study with just 30 people, found the money to have them tested independently. So they would go somewhere else to get their baseline testing after treatment. And she did this also in conjunction with an ophthalmologist, August Reeder in San Francisco. But again, it was refused for publication because one of the principal authors, the letters that came back said from the ophthalmology journal said, well, we don't publish things where one of the principal authors isn't an ophthalmologist, which was a little bogus, I'll say that. But because she was showing, this is, how many people know what a Humphrey field of vision test is? Not many, so let me tell you. You basically sit in front of a white screen, and the machine flashes a little white light at random points around the scene. Every time you see a flash of white light, you push a button. And it varies the intensity of the white light and varies where it flashes it. And it's done with a computer, and it basically sums up, and it can map out where you see and where you don't. Some places you may see, but the light has to be really bright. Other places you can see even when the light's dim. And it comes up with sort of a graphic representation like this. So here, this before picture, this person didn't see much. And here, after treatment, their vision's opened up. This is after 3 weeks of treatment. Before, after. And so we use this because this is a very sensitive test for showing the early changes that happen. Sometimes this test will show up things before the person is actually sure that they're seeing subjective change in their vision. But also, this is the kind of black and white data that doctors like, that it's not just somebody saying they see better, it's actually a measurable, reproducible, and documentable kind of thing. So this person had macular degeneration. This person had retinitis pigmentosa, and again, black is bad. If you don't remember anything else, black is bad. You don't see anything here, and then their vision opens up. And so, but you'll notice that it opens up not just centrally, but peripherally. And because that's where the disease is worst in retinitis pigmentosa. Here, they're still left with some central defect, but not nearly as dense as it was. And so the way people describe this is that what had been a huge black scotoma, a big black spot in the center of their vision, what they perceive is that it begins to open up. It grays out. It's like instead of being just the vision is gone, it gets gray. There are little windows where they can kind of position their vision and see through things, and eventually it opens up and they can see. Also, it's very interesting that it doesn't just come back normal. So when these cells in the retina start to regenerate and start to work again, they often have all kinds of bizarre phenomenon, flashing, strange distortions. It's very disturbing. So a lot of times you get calls, I'm getting all this weird flashing, and as well, it's just your retina's waking up again. it's starting to see where it was just black before, so at least that's good.